today. It's been such an amazing event the last 2 days. I've been following it, and it's been wonderful to hear everybody speaking. So hopefully everyone can see me okay. I'm just going to talk a bit for the first bit, and then I'm going to go on to a little bit of a slideshow. But what I want to say about the talk that I'm going to do today is that I'm going to talk about birth preferences and how we can link it to caesarean section, because I think it's often missed quite a lot at antenatal classes. We all kind of scoot over that bit and pretend we're not going to have to go there, hopefully, unless it's a planned C-section for things like you've got a breech baby or you've got full eclampsia, the placenta previa, things like that, where we might be knowing we're going for a planned caesarean. So what I'm going to talk about is actually linked to my birth stories. So I became a physio, a long time ago, and I've been in women's health and interested in pelvic health physio for about 10 years now. It coincided just before I got pregnant, so it's perfect timing for me because I had no knowledge whatsoever. I just really loved the knowledge I got from doing my pelvic health physiotherapy rotation. So there are some wonderful people out there sharing loads of brilliant information. And one of the things I really want to talk to everyone about first, and apologies if I'm plugging a book, but this book, the Positive Birth book, which I think I've sent the link to where you find it, written by Millie Hill, was an absolute godsend for me in my second pregnancy. Just a little background about me is that my first pregnancy was a breech baby from 20 weeks right through to delivery. So I knew I was having a planned section for a very long time, tried everything to get the baby to turn, but he didn't want to. So I actually went into my first birth 39 plus 3 days or something, and no labour, no Braxton Hicks, full on, we're going for a caesarean, which as a first time mum is a bit frightening, particularly when you've worked in pelvic health physio and you want to do it naturally, of course. So I hadn't read this book at the time, but this book came around to me 5 years later when I decided to get pregnant again with my little girl, and I was going for a VBAC, which is a vaginal birth after caesarean. So I felt a bit cheated with my first caesarean because I had to have one, it was planned. So with my second one, I really didn't have a clue what labour felt like, I didn't know what to expect, and I felt quite clueless. So this book, I honestly think we should give them as a handbook to every pregnant woman. I'm sure there's a million good pregnancy books out there, but the thing that's wonderful about this book is that Millie talks through 13 stages of labour, what it feels like actually goes into the nitty gritty, not the medical management 3 stages of labour that we all talk about as healthcare professionals. So it's a little bit more personalised and makes more sense, like in your head, than just medical jargon. But what she talks about so beautifully is that she talks about vaginal birth, she talks about induction of labour, she gives positive stories from all aspects, and she talks about positive caesareans. So in my second pregnancy, I wasn't planning to have a caesarean. I was really hoping for a vaginal birth, but I did read this book and I did get inspired by what she'd written, and I did make 2 birth plans, which I will come and discuss with you about birth preferences, because a lot of the things that we think about for vaginal birth actually can apply to abdominal births. So it's really important that we get the message out there that if you're querying you may have a caesarean for things like breech babies, things like is your placenta covering the bottom of the os, is it going to move up and out of the way, low-lying placenta? It's good to just have a little bit of a plan, or just a knowledge and awareness about what you can ask for, because it's so empowering. When you're having a caesarean caesarean birth, pardon, it kind of sometimes feel that you haven't got any power, you kind of feel powerless. So to be able to empower your birth experience with choice really is quite a big deal, actually, emotionally, and afterwards for helping you recover from the surgery. So what I will show you, if I can, I'm sorry, because I'm just literally going to hold up the book, is that what I loved about Millie Hill, I'm very visual. She creates lots of little circles, and I hope you can see these, of things that you can write in your birth preferences. And there's been a lot of talk recently about word choice, words matter, and it's important we think about preferences with birth and not a plan, because if we make a plan and it doesn't go to plan, we feel like we've failed. So it's really important we think about our word choices, and that we can have preferences, and this is what we'd like, and we can make multiple plans. So, you might have birth plan A, B, and C, it's okay. That as long as you feel like you've got choice and you're empowered, then the more preferences we make, the better. We've got choices then when it comes to it, if we need to make a different route as to the one we want to go down. So within the book, there's lots of different birth preferences, written by various different scenarios. So people that had home birth, people that had a vaginal birth in the hospital, in the midwifery suite, in the labour ward, people that had a caesarean, people that had an induction of labour. And it's just really, really nice. I just love the pictures, because I don't know about you, but when I was kind of going into that third trimester and trying to liaise information, my brain, like we've just heard from those talks earlier, which was wonderful about the brain upskilling, I couldn't converse quite well what I wanted to say. So it was really good if I just had it as an image. So I made books with my babies, like when I was pregnant, and I just kind of used these books to record things that I wanted to remember, and then obviously have it for them. So like I said, I was going for my VBAC, and I'll just show you, hopefully you can see this. It was an A4 piece of paper. It just had little pictures on. I just wrote tiny little bits of information on all the way down to the bottom. So what I want to share, so that was my birth preference for vaginal birth. But I had a tiny suspicion, I don't know if I just a bit suspicious because I'd already had a cesarean, but I also had a backup plan. And it didn't have much on it, only had a few circles, but I drew a lot on it when I was in hospital because I knew that I was going for a cesarean at the end. So what I want you to get from this talk, I really hope that comes across, is that a lot of the things that you can ask for with a vaginal birth, you can also ask for with a cesarean and abdominal birth. And that's super, super empowering. So just to give you a bit of an idea of what I put in my birth preference, and this is totally independent, so we're all different, and Millie Hill really goes through that in the book about how many different choices there are and what you want and what you don't want. So it's purely individual and unique to you. There's no right or wrong answer, and there's lots of other people who have got things out like this on the internet. So I'm sure if you Google birth preferences pictures, you could come up with one just as easy. So my birth preferences, I ideally wanted a midwifery-led unit because I wanted the peace and quiet of the unit, but because I'd had a previous cesarean, they wanted me to be hospitalised and put on the monitors, which was something I didn't really want to do. But I recognised that because I'd had the previous cesarean, they needed to monitor me and make sure that I didn't have any complications. So the other thing I asked for was hands off. I didn't want my care provider constantly checking me and doing internals in particular. I wanted to like have a quiet background and surroundings. And then the other thing I'd put on here, I'm so sorry I did put this, no medical students. This is purely your choice, but be aware that these people might come into your space, your birthing space, and if depending on how you want the environment, the more people can sometimes make it feel less personal and less private and not help you to go into that lovely oxytocin bubble of deep cave, I'm going to give birth. And so just be mindful that these are choices you can make. And, you know, some of these, the first three obviously don't apply to cesarean abdominal birth. Hands-on is pretty much what you get, but you can ask for no medical students, and that's the same thing, okay? A little bit about my previous birthing background was that I'd had one previous birth and that it was a breech baby. And then there was other good things that Millie had put about how are you feeling about birth. So I was feeling quite positive, but again, if you're anxious or you've got fear of something, then this is a beautiful little picture and symbol you can put to express that to your midwife or team who are looking after you. Another little bubble that Millie talks about is negotiating consent for internal examinations. Sometimes when you're the patient, you don't feel like you've got the control of, you're being told you need this examination and you really don't feel there's a choice, but you always have a choice. And it's hard to have that voice sometimes when you're in that landscape and things are very changing and you maybe not been there before. So it's really important that you do be aware that you can always withhold consent and it's your choice, okay? And I don't like the word withholding consent. They use this a lot in medical language. It's more about choice and it's your choice. So it's about empowering your voice as well. There's a little rhyme there, isn't there, in there somewhere. So with me, I was adamant I didn't want an induction and I also didn't want my waters breaking. But again, there's symbols for saying, you know, you do want induction and how you want that to be done. So there's brilliant little pictures that you can, again, personalize your preference on your birth preference sheet. And I really didn't want the CTG monitoring, which hilariously is what I got attached to for 3 days before I actually had my second baby. So other things, I'm just going to scoot down this because I'm not sure how well you can see it, and sorry, I apologise if I'm not holding it very well. I wanted a natural birth. So again, you can write on things here about how you want to give birth. I wanted to be on my hands and knees. I wanted to be moving about. I wanted to be active. I wanted low light levels, so I had little candles and stuff ready with the batteries. I honestly, I went to town with my birthing kit. You can see up here. I don't know, I had the little candles. I had a birth board and a vision and my peanut ball and all my holistic stuff. I was raring to go. I was just gutted I didn't quite get there. Another thing about quietness in your birth space. There's one here that says, quiet please, no chatting, and no ward round inside my bed space. Please take the notes away and out of my birth space. So, you know, if you're giving birth and there's a ward round comes round with all the doctors, they will all pile in, because there's not normally one doctor. He's got an understudy person, a registrar, and then he might have another younger doctor, and then there might be students. Like I said, you can get a massive entourage of people coming into your birth space, which can really stop you and throw your like wonderful birthing moves that you're getting into. So again, just be aware of that. If you're going into the medical hospital situation, this is quite normality for people working there, but you don't have to have it. So again, write it on if you don't. So I didn't want, there's bits here about a fecal scalp electrode, so fecal blood sampling. It's where they attach a little electrode to the baby's head that they insert vaginally. I didn't want anything like that done to me while I was labouring, so I'd written that on my birth plan too. And I'd put focus on me, not the machine, because I do worry that when you get put on these machines that everyone's looking at this bit of paper and not the mother or the person who's pregnant. So it's so tricky that getting that balance, isn't it? And that's something I really didn't want, and unfortunately that is exactly what happened. Like I said, I'll come on to that in a bit. So here I'd written about an active birth. I wanted freedom of movement. I did want to be in the water if I was allowed. I did want to be able to eat and drink. I did want to use a TENS machine and to have massage by my birth partner, and I was using hypnobirthing. So I'd put all those things on there just so they were aware of what my choices were leading up to my birth. And then you can put things like, don't say, for me, I'd put don't say contraction, please say surge, or I'd written wave. I thought it was a bit more, again, like the word choice matters, doesn't it? Because sometimes contraction to me thinks pain, and I wanted to not think of those things and connotate negative words to it. So again, you can write these in your birth preferences. What's other things? So ask permission. My consent is important. That is really important to be on there, and just to not assume that it's a given. So again, you can discuss this normally with your midwife before birth, or if you're going into hospital, you know, give them a copy. I think I had 4 of these. I literally used to give them to anybody that was like wanting to speak to me. Whether they look at them is another thing completely, but if you have it on a bit of paper and you know, like you're in that labour land world, you're not going to be thinking that much about trying to tell people about this, and you don't want to be. You want to be focusing on your body. So this is where something like this comes in really, really, really handy. The other thing I would say about a birth preference plan is that some people say, oh, I'm just going to go in and I'm just going to go with it and I don't want to pre-plan anything. That is okay, but what I would challenge with that is that you don't have a voice when you get in there if it comes to anything where you have to make a decision. So it's quite good to just do a bit of background research before you go into hospital or have your home birth about choices, about what's going to be happening, and that you kind of have a little bit of a mental plan in your head about what your preferences are and what things you would like and what things you may not. So this is really, really important that we encourage people to take power with them into their birth space. So then other things you can put on here is about pain relief, like what you intend to use. So mine was TENS machine. I didn't want people to offer it to me. I wanted it to be given when I asked for it. If I want it, I will ask for gas and air. So there's a little picture here of that. And then let me listen to my body. Please don't tell me when to push. Again, some people like that. It's important. So again, you could put that on there as a little like symbol. And then you can say like, who do you want to catch the baby? Do you want your partner to catch it? Do you want to catch it? The midwife? Like you can have little symbols for that. Don't wash or wipe my baby. That was a really important one for me. And then optimal cord clamping. So the ones at the bottom here, I'm going to come on to with cesarean, because all these things you can apply to an abdominal birth. Dad to cut the cord, skin to skin immediately, again, is something we can apply in abdominal birth. And calm and dimly lit first hour and delayed weighing and measuring. So I remember my first baby, I didn't know any of this, and he just got taken off me, rubbed down, put on the weighing scales, and I was a bit like, well, that's a bit weird, isn't it? And second baby, I was like, I want her to come to me and I want to have her, and she just stayed on my chest for a good hour and a bit, and it was so different. The experience and the bonding was so different, both abdominal births, but both completely different experiences. And then about your placenta, so I really wanted to keep my placenta. I wanted to encapsulate it. So there's a bit here about I want to keep it, because often they just take it away and they get rid of it. So if you do want to keep it, please make sure you put that on your birth preferences. And I wanted a physiological third stage, and I put there I plan to breastfeed. So again, you can put there if you've got any feeding preferences in your birth preference section. So my hand's going to come off here, but this one is the one that I really need to speak about. And when I was teaching Pilates to my pregnant ladies, we often used to have discussions about cesareans at the end of the class, and like what you could ask for and how you could be empowered in your birth. So I'm not sure if you can see this very well, so I might just talk through it. So Millie Hill talks about making the best possible cesarean plan for you. So in the cesarean setting, obviously it's a brightly lit room, so it's very hard to get that dim, dark, lovely kind of quiet cave mentality going on. But you can still ask for music to be played, you know, to try and help the atmosphere to be a little bit more calming and reassuring. You can ask them to talk you through what's happening, or you can ask them to not talk you through what's happening. Again, it's purely preference. Things like, do you want the screen lowered, or do you want the screen up when baby's born? You've got choices with that as well, so you can actually see your baby being birthed. And then there's pictures that Millie Hill does about where do you want your IV line. So you always have to have an IV line if you're having a cesarean section. And my first baby, I had it put in here in my wrist, and I really found that after surgery I found it hard to move about, and every time I tried to use my arms to help me move up and down the bed or turn over, it really dug in, and it wasn't very helpful. So, you know, if you're right-handed, you might say, please put it in my non-dominant hand. But with my second baby, I had it actually sighted here, like into a venflon in my forearm. And at the time I thought, God, that's a really weird place to put it. And I was like, why have you put it there? I've never seen one the whole time I'd worked in my 12 years NHS career being sighted in the forearm. But postnatally, I was able to move about, I could use my wrists, and it was way better placement, to be honest, to allow me to move. So again, think about those things. They really make a difference afterwards, so they're quite important. So another thing that's really important is that if you would like skin to skin with your baby post cesarean, is that you ask for they put like they're called EMG dots on your chest to monitor your cardiac output while you're having surgery. Well, you can ask for them to be put on your back, and then when they're put on your back and the leads are behind your back, as soon as baby's born, you can have that beautiful skin to skin sensation and cuddles, which is so nice. Because I don't know if anyone's aware, but when you have a cesarean, I think it literally takes about 5 minutes to get the baby out normally, and then you're there for about 45 minutes to an hour being sewn back together. So it's you know, the bit afterwards is, I don't know if people talk about what actually happens in a cesarean, but I think that that's really interesting to be aware that, you know, the procedure will happen, the baby will be born relatively quickly, and then afterwards you're there a long time while they're sewing you back together, your tummy muscles and everything that they've cut, your uterus. So that skin to skin time is really special. It helps you to obviously bond with your baby, it helps you to remain calm, and you've got something to focus on. And just having the ECG dots out of the way makes a huge difference. You can actually get a really nice cuddle. My son was put around my neck like a little scarf and peed all over me, whereas my daughter was like down my chest and like proper in cuddling. So it was just, that was wonderful. Like that's like, I would imagine, I don't know, because I've never had a vaginal birth, but you get that beautiful connection straight away. So again, it's a positive part of the abdominal birth, and so ask for that. I did ask if my baby could be born slow and gently. So I don't know if people have heard, but there is gentle cesarean sections happening up and down the country, only in certain hospitals. So this is where your baby's given time to actually work out of the uterus and through the abdomen by itself, and it kind of does a slow crawl. And there's a video on it. You can see on my Instagram pages and Facebook pages, I've got lots on cesarean section there. So please head over there to have a look at this. And the baby will actually, especially if, like with my second baby, I was already in labour actually going into my second cesarean. So I felt she was trying to, I could feel her descending down and she was trying to come out. So I did say, please, can you let her come out with like the contractions I was having? But their policy in the hospital didn't do or support gentle cesareans, but I kind of pleaded with the consultant beforehand, and I think she didn't wrench her out like she did like what happened with my boy the first time. So I felt she came out much slower, much more calm, much more controlled, and it just felt much more natural. As natural as you can get. But it's a beautiful sensation if you can pre-plan that and, you know, go through that experience. It's really, really powerful. So The other thing was delayed cord clamping. I wanted them to leave the cord pulsing, and I found it really weird. Like with my first little boy, you know, they pulled him out, they cut the cord, they washed him, wiped him, gave him to me. And when with my little girl, she came out and she did a bit of a cry, and then it all just went silent. And I was a bit like, where is she? And where's she gone? What are you doing? And they put her between my legs to allow the cord to stop pulsing, and she just laid between my legs on the bed, quite happy, despite bright lights, bless her, shining down on her eyes, while they waited for the cord to cut. And that was, again, a beautiful moment where I thought, they're listening to me and they're listening to what I've asked for. So again, I was empowered at that point too. I asked for Dad to cut the cord. He could still do that, even though it was a cesarean abdominal birth and not a vaginal one, so he was still involved actively, so that was lovely. And then I asked for the calm and dimly lit first hour so that we weren't interrupted, and we did get that. And it was one of the most precious experiences and memories that I'll hold forever, because it was just beautiful. So there are parts to the abdominal birth that can be just as special as a vaginal birth, and I just want to hope that people listening feel empowered that they do have that choice to be connected. So that's really wonderful. Also delayed weighing and measuring. I asked for that and we got that. They didn't weigh my little girl straight away. She's not really going to weigh any different, is she, in the first kind of, hour or two, I'd imagine. So that was brilliant that they supported that. And then I wanted to keep my placenta, and hilariously, the reason I ended up with a second cesarean was because my placenta failed at the last minute and it was calcifying. But I did want to keep it, and I'd arranged to have it encapsulated. And I got to see it again in my calm first hour post-birth. The midwife showed me it and she explained it all to me, and it was amazing. They're massive, your placentas. I don't know if anyone else is interested. They're like bigger than the size of your head. They're like a huge dinner plate. So I found it fascinating. So again, something I personally really loved, to have that part of me back and see it. I found it fascinating. Other people might think that's really gross. That's fine. There's no right or wrong way with your placenta, but it is a beautiful thing to look at and see what's nurtured you and kept you and your baby together and connected. So yeah, and I have pictures of it too. And then I also said I plan to breastfeed. So I wanted help with that, because following my first son, I really struggled to breastfeed. I did manage, but I really wanted some help. And she did manage to do the whole crawl herself up and find the breast and attach. And again, that was really special because I was supported by the midwife. I was given the opportunity to do that in the time. So I'm sorry, I do talk really fast, so I hope you kept up with what I was saying there. But what I want to say is that you can have a very powerful abdominal birth where you feel like you have the choice and you're in control, whereas obviously from a surgery point of view, you're not in control as much when you're giving birth through the vaginal canal. But I just want people to be aware that having the choice and doing some background reading and doing some pre-reading, just to give you those choices, and then you get to choose, really helps you to feel empowered where you go, whichever direction birth takes you in, because often we don't go down the road we think, we kind of go a little bit wibbly wobbly down that road. So I hope that's good for birth preferences, and please, if you've got any questions or want to ask me anything, or if you can't understand what I'm saying, please pop them in the chat with my Yorkshire accent. That's absolutely fine. So I think that was everything I want to say on there. And then I wanted to cover cesarean section recovery, because again, it's not covered, is it? And we're just not given enough information and advice. So I will go into that bit and then we'll pause for questions at the end, if that's okay. I'm going to try and share my screen now, and I apologize because I'm not very tech savvy. So if you lose me or it doesn't come on, oh, I'm seeing Suzanne's screen. Do I need to do anything different, Suzanne? Hang on a minute. I don't want to share Suzanne's screen. I want to share my screen, but where's my screen gone? If I can't get it to work, I'll just keep chatting.
Yeah, I've just popped on. I've heard you saying the question. You should be able to share your screen. It should just say share screen. So have a little.
Right, I'm pressing share screen, but it's coming up with your background for some reason. I can't see my screen to share.
Oh, that's odd, isn't it?
Oh, bad with tech. I'm sorry. Hang on. Let me see if I can maybe move that. It just says Suzanne Benazer. I don't want to leave because I'll lose you all, and I'm not very tech savvy. Don't worry. It's not really anything. There was just one video that I was going to try and link to, but it's okay. Oh, exit full screen. Maybe if I bear with me, everybody. If I click on this, is it going to work? Did that work?
No, I don't think it did.
Okay, just don't worry.
Strange, because you should be able to share, but
Did that work? It's worked on my side. Has it come up on your side?
No, I don't think so, unless there's a bit of a delay. No, I don't think so. Is it on the bottom panel? It should be on the bottom panel of Zoom, next to chat.
Yeah, press share screen. Anyway, it's not working, don't worry. I told you.
Okay. I'll be quiet again.
Thank you. Sorry, Suzanne. Okay, so let's talk about cesarean section recovery. I cover every month in April. There's a cesarean section awareness month, and I talk pretty much throughout the whole month about cesarean. So if you don't follow me on Instagram or Facebook, please have a look on my pages, and I'll pop the links in for you if they're not already there. So let's talk about cesareans. Let's talk about recovery. So it's super, super important that we, again, give women more knowledge about this and empower them with their births. So abdominal surgery is major abdominal surgery. We have, oh, it's a shame I can't share my slides actually because I had a picture of some abdominals, but never mind. We have so many layers cut through for an abdominal birth. So I don't know if anyone knows the answer to this, but put your answers in the chat as to how many layers you think are cut through before you get to your baby. Because what we need to remember with the cesarean is it's not just the bikini line scar that's healing, it's the deep scar, layers that have been cut through to get to baby. And there's quite a number of them, and we go quite deep down. So I put on my Instagram account quite a lot, the East 17 song, we're going deep, baby, deep, deep down, because does anybody know how many layers? I'm not looking at the chat, but has anyone got that? 8, yeah, 5, okay, thank you for putting like little answers in. Okay, so yeah, it is deep, it's 7, so well done for those people that have just popped that in. 7 layers down until you reach your baby. And I had a little video to share with you of this. There's a great felt project somebody did about all the different layers that are cut. And what's really interesting to look at is that the most of the cesareans are vertical and cut across, so horizontal, cut across this way. But when you get through a few layers, they actually start to go vertical, and then they go back to horizontal when they get to your uterus. So you have layers that are cut this way, then you have layers that are cut up, and then the uterus is cut across as well. So the healing, and you remember when I said about being sewed up when you're in theatre, it takes a long time because there's a lot to sew back together and the different directions of the fibre. So this is important to know this, because when we're healing, there's a lot of healing going on down there that we can't see. We can see the top scar, but it's the underneath bit as well that we need to make people really tune into with regards to abdominal birth. So that's the first thing I just want to raise. The other thing I want to say is that what happens to your bladder? Well, in the cesarean, in the felt picture that they have, they show the uterus here with the bladder sat as a pocket at the front. And it's go, yeah, the bladder's just moved out the way. And it literally is, the organ of your bladder is moved away from the uterus. So obviously they try and avoid surgically cutting the bladder to get to the baby. But you've got to think that might get a bit bruised, it might be a bit sore, and we've got to think about bladders for postnatal birth abdominally as well as vaginally, because we can have things affected there. And I know Suzanne's just talked about the bladder, but I know for me, when I had my second child, I don't remember with my first, it's too long ago, I couldn't pee properly afterwards. So you're catheterized, and then the catheter's removed, and they encourage you to drink a lot of water, go to the toilet. Some trusts will make you do it in a bucket and they measure it to make sure you've done enough, and others don't. But what's really important is that when you go to the toilet, one, you can go to the toilet and just allow yourself to relax and wee. 2, that as you're peeing, the flow's not stop-start. It's coming as a continuous flow and not a trickle or a bit and then a stop and a bit and then a stop, because that's not your normal, well, I say that's not a normal bladder function. Whatever your normal is important that you feel that after. And if it's different, do tell somebody. I didn't. I think I thought being a pelvic health physio would be okay, but actually I think I was a bit bruised, and I struggled a little bit with that. So please take care of your bladder after you've had a cesarean as well. So I just wanted to raise that one. So so the abdominal muscles, what do? We have 4 abdominal muscles, just in case we need a quick anatomy run. We have the 6-pack that runs down the front that most of us wonder if we'll ever see in our lifetime, the rectus abdominis. We have internal and external obliques that run diagonally, sort of behind that big 6-pack, and you can see them at the sides. And then deep, we have what's called a transverse muscle, which is a bit like a corset. So imagine like Charlotte like a, you know, Pride and Prejudice, the Brontes, where they all wore those corsets and they all pulled up the boobs and they all had those tight like things walking around there. That's your transverse abdominal muscle, and it attaches all the way from your rib cage, breastbone, all the way down to your pubis, and then right around your tummy and your back, all the way to your back. So it's a huge sheet of muscle that is also obviously cut during surgery. Now, these muscles are so important for many things we're unconsciously aware of that we do every day. So when we have changes to our intra-abdominal pressure, which can be anything just as like being upright, as opposed to being slumped, standing up, sitting down, turning over in bed, getting in and out of bed, getting in and out of the car, the bath, you name it, cough, sneeze, laugh, and even poo. They all have intra-abdominal pressure. So there's all pressures transmitted from the inside. And when you've had any injury or any surgery, you will know the body part that's been affected. You were very appreciative of it and what it did, because you didn't realize the jobs you just took for granted that it wonderfully worked, because they're sore. They are sore. Okay, so, and you know, thinking about it's going to be sore to cough or it's going to be sore to stand up, it can be really frightening for a lot of women, and we want to reduce the fear factor and help you know how to manage that. So that's what I'm going to come on to. So in those early days after your cesarean, the main, super main thing is that you have pain relief, that you take it regularly. In hospital, this can be tricky with the ward rounds and there's all sorts going on, isn't there? But, you know, if you're struggling with pain and you're not getting it regularly, don't be scared to buzz and ask for it. If you don't ask, you don't get. And I'm really sorry to say that, but you really need to push that point, push your pain relief. If you're struggling to function, like if you're really struggling to get in and out of bed, turn over, get up, go to the toilet, try and get your pain relief 20 minutes before you need to do that. Or if you're going to plan a shower, have your pain relief 20 minutes before, because that's when it generally starts to kick in. Then you should be allowed to just move that little bit freer and a bit easier without as much tension. The other thing I would say about pain is try not to fear it, because hurt doesn't mean harm. And it's going to hurt, I'm going to be honest, but it's not going to harm you. And there's just finding that balance between, you know, sharp shooting pain that is agonizing and a bit of a horrible deep ache that's surgical pain that's uncomfortable. You can kind of get a balance between which is acceptable and which isn't. But if you're struggling with 10 out of 10 pain and you can't function and it's really, really sore, ask for stronger painkillers, because you're not going to get moving, you're not going to get blood flowing, you're not going to heal as good. So it's super important we encourage power around pain relief and empower ladies to ask for that if they need it. Ask for stronger if you need it as well, because again, if you don't ask, you don't get. They will just give you what is prescribed, and if it's not touching the pain, please do ask for something stronger. Okay, you know, trust your body, it will scream at you if it's not happy. The other things to think about in the first early hours postnatally is about supporting your wound. So, you know, like turning over in bed, standing up, for example, coughing, sneezing if you're unfortunate enough to have a cold or anything. We need to be looking at pressure management. So I talked about the pressure coming from inside the tummy that like pushes out. And obviously if you had surgical incisions to your abdominal muscles, we need to counteract that from the other side. So as physios, we encourage people to take a pillow or a rolled up towel, support your wound, and then give a good cough if you need to, or support your wound and sneeze. Now, if you've nothing to hand, and it happens quite a lot, doesn't it? Grab your hand, 2 hands, and just apply pressure directly over your wound firmly, and then cough or then sneeze, because it just helps reduce that intra-abdominal pressure. You're counteracting it from the outside, and it just allows the pain, the uncomfortableness to be a little bit less so, if I can say that. But it again just empowers you to be able to support and protect your wound and know that you're doing something to help your healing, rather than coughing without that support, and it can feel quite uncomfortable. So that's what I wanted to say about those. When you go to the toilet, so I did touch briefly on your first wee, make sure your feet are flat on the floor, make sure you're slightly upright leaning forward for your wee. Give yourself time to go. So if visitors are coming and there's someone able to watch your baby for you, you know, be kind to yourself, expect to go and sit on the toilet for a little bit, breathe, and just try and relax. So we don't want to be rushing to the toilet and rushing back again. That's not ideal with your first wee and poo post-abdominal birth. So I've got some tips with your poo. We had a brilliant picture, I think yesterday, by the colorectal nurse about pooing. You want your feet up on a stool if you can, to have your legs up slightly to lower your bottom down from your knees, and then you want to lean forward, because it just helps your back passage to relax. So it's not on that angle, it helps it to be a bit more gravitationally assisted. Please don't strain to go to the toilet. So again, if you feel like your wee's not coming out or your poo's not coming out, try not to bear down and push, because again, that's an increase in intra-abdominal pressure, and that's going to have that pressure on your wound healing. So we'd rather that you ask for laxatives or stool softener, just help you feel relaxed. And again, take your time. Please don't be rushing for that poo, thinking you've got to get back to the baby. Wait till someone's there, or ask the nurse or the midwife to help, that you need care looking after the baby while you go and do that. If you feel pressure to poo, please go and do it. Don't put it off. Just go with that pressure. That's your body telling you it's ready. And again, try not to fear it. Try and breathe, relax. It will feel scary, but just know that your body knows what it's doing. Allow it to do its thing, and allow it to do it peacefully without being interrupted. And I'm not sure about you guys, but when I had my cesarean, they didn't want me to go home until I'd done a poo in hospital, which for some people can be quite awful, can't it? Because you always want to do it in your own home. But again, you just need to try and set up that environment and that quiet time and that calm, and just be able to take your time with it. The other thing we want to avoid when we're straining to poo, obviously from the cesarean scar point of view, but is also the risk of hemorrhoids and giving yourself piles, which on top of a surgical scar, you don't want hemorrhoids on top of it. It's just something else that you don't really want to have to deal with. So all these wonderful things about giving birth that we need to think about. So I'm just going to go, I'm just aware of the time, sorry Suzanne. So when your body's healing, please remember this. So apologies if you can hear the massive aeroplane flying past my house, because we get these like huge cargo planes coming past. One of the things we get told after we've had an abdominal birth is that don't lift anything heavier than your baby, because your body's healing. So I think this is really interesting. I could talk about this for hours, but my baby was, I think I've forgotten, that's terrible, isn't it? She was £6.10, and I'm quite small and petite. So for me, that was, nearly 7 pounds of baby to carry about. But like my friend's sister, for example, she's the same height as me. She had a 10-pound baby. So day one for me was a 7-pound lift, and day one was a 10-pound lift. And it's really interesting about they say about, just lifting the weight of your baby. I guess you've got to put it in context that you've been carrying the baby in uterus, so hopefully you've got that kind of body awareness. But it's an interesting topic about how much you should lift, and I know people always say, what should I lift, how much should I lift? It's individual and unique to you. It depends on your pain, it depends on how much support you've got at home, who else can help you with the carrying and lifting, and lots of other things. So please, please, please remember, when you start lifting your baby and going out and about, you will also be lifting a pram, a car seat, various things if you're getting back out and about driving. And sometimes turning the pram and the twists and going up and down hills can be quite intense on your tummy. So again, when you want to get back out, try and go for flat walks initially, and try and just go slowly and just take your time. And the most important thing is that we're just trying to lengthen our body and walk a bit taller every day when we're trying to get out and about. So listen to your body, tune into it physically and emotionally. Emotionally, it can be such a journey post surgery. So again, please do take that into consideration. And I loved what Katie said earlier about your emotions. It's such a roller coaster, so try and ride it rather than fight it. Delegate your heavy housework and meal prep. I know various friends of mine that have gone back to hoovering at 2 weeks and split their stitches. We might feel good on the outside, but remember the deep layers inside are still healing. So it's super important not to ignore that. Try and get people to prepare your meals for you if you can. Lots of standing, lots of static postures are really not good for us post-surgery. So again, we need to be resting and recovering. We need to be sleeping, which is essential for healing. And that is the complete antithesis to life with a newborn, isn't it? So, we're getting a double whammy really with abdominal birth. We're really put under the quite a big task, quite a big ask as well for mum. And I think like the sleep deprivation for me was huge. And so healing for me was really, really difficult. And if you're struggling, please, please don't do what I did and just try and cope. Please ask somebody and get help, because people want to help you. It's just difficult to ask, isn't it? So I don't know if I've heard this again before. I don't know if Louise mentioned it, but movement is motion in lotion. When you've had an abdominal birth, it's important we move little and often. Often when we sit static and still for a long period of time, when we go to move, we feel sore. And it's not the movement that's made us sore, it's the prolonged posture we've sat in and not moved about in for ages that's made us stiff and seize up. So try and keep moving little and often, try and keep changing position, try not to stay stuck on the sofa for 3 hours. When you're breastfeeding and they're cluster feeding, I know that's really tricky, but you will feel a bit uncomfortable when you come to move. So again, make sure your pain relief is, again, tallying up if you can. I know it's really tricky, we've got so many things to think about, but just thinking about movement and pain relief with what you're doing. But avoid sitting still on the sofa all day. It's not a good thing by the end of it when you try and get up. Walk taller every day is what I mentioned before. And if you can, taking those small, shorter strides will really help. If you take out a huge stride and leap forward, your tummy muscles might still be behind you while you're kind of trajecting forward. So again, just be gentle, allow yourself that time to heal. Circulation exercises are great and so important post-surgery. Again, we've got to be mindful of risks of deep vein thrombosis. And things that you can do, again, is just wiggling your feet up and down, wiggling your toes, moving your ankles, circling them, imagining your big toes a pen and writing the alphabet. It's quite a nice one. And try and put your feet up a little bit if you can, if it's not too much on your wound with your knees bent. So don't spend all your time with your feet down. Do try and maybe go on the sofa with your legs up a little bit, put pillows under your knees if it's pulling on your tummy or your back. And just try and squeeze your bum, relax your bum, again, just to get the circulation flowing up and down your legs. And as physios, we always taught people to do what we call static quads, which is where you suck up your kneecaps towards your thighs to get the blood pumping in the quad part of your leg as well, the front of your thighs. So get my teeth in. Movement nourishes you. We want you to move. That's how we heal post-surgery. That's how we get new blood flow to the areas that are sore, and movement allows you to do that. So movement is really crucial. But again, if you're in pain, that needs addressing first to allow you to move. Start your pelvic floor exercises after your first wee. So everyone panics about exercise post-cesarean section, but actually it's really important we start doing some gentle exercises, some squeezes. And as long as you're weeing okay, like I mentioned at the beginning of the talk, then pelvic floor exercises will not only bring blood flow down to your undercarriage, but it will also help the healing around your abdominal area that's been surgically cut, because there's fascia between the pelvic floor and the abdominal muscles and they connect. So any squeezes we can get going on here will also help healing and blood flow to that abdominal area. So super important. Regress to progress. So obviously when you're looking to get back to exercise, try not to go back into doing planks and stuff. You know, we need to build up to that plank position. There's so many fabulous fitness professionals and physios out there working in pelvic exercise. So please Google someone that knows what they're talking about, especially if you've had surgery. And there's a 12-week rough guideline. So there's been some return to running guidelines published that said, you know, we need to be working on strength. We need to be working on improving our abdominal strength and core muscles before we get back. And, you know, major muscles as well, not just the core, before we get back to running. So please don't have a cesarean, don't do anything for 3 months and then try and get running the next day. You need to be working on strengthening your calves, your quads, your bum, your arms, working your pelvic floor, working your abdominal muscles, getting blood flow to them, strengthening them before we hit the trainers and start running again. So super important we do it gradually, but we can return to all activities we did before, providing, you know, we think about it sensibly and do it slowly. Last thing I want to touch about, I'm sorry Suzanne, but this is super important, this one, scar tissue management, super important. So in the early days post-surgery, we really need to be lying down 5 minutes, 3 times a day if we can, and taking that area of skin, the stomach that's over the top of the wound, because the wound is very much in your pubic hair, and obviously the tummy muscles have lengthened for 9 months, and we get that relaxing of the tummy muscles. They're not as strong anymore, are they? So naturally with gravity, when the baby comes out, they tend to sink down, and often as a lot of us get the mummy tummy where it hangs over the wound. So we need to really take the time to bring the extra skin back up and allow air to get to that scar to allow it to heal. It's super important. If we don't allow air to get to it, it's getting sweaty and hot, we're more likely to get a risk of infection. So really simple tip, really important for healing post-surgery, really difficult with a baby, but again, we need to make that a priority that mums know to do that. Look at your scar as soon as you can. Please try and be loving to your scar. It's really nice if you can put your hands near your scar and just breathe into it and try and get some energy down there, because a lot of us disconnect from our pelvis. When our baby flows up and out of the sunroof and not down through the love tunnel, we don't get the natural hormone play out. So a lot of us can feel disconnected to our pelvis post-cesarean. So it's really important we work on energy association down there. So my next thing is, you know, support it. We've talked about cough and sneeze, if we need to give it that support. I used to wear a sanitary pad on the inside of my knickers to press against my scar so it didn't rub or chafe in my clothes. And I know a lot of physios encourage you to wear tuba grip and things postnatally, just to encourage that knitting of the muscles back together, to give them that kind of feedback from the outside, like a proprioception feedback. Please, if you can, start touching your scar as soon as it's fully healed. Now, the rough bench line is 4 weeks, but But we're all individual. It depends on, is your scar fully healed? If it's oozing or smells or has got any fluid coming out of it, or there's an open patch, that's not fully healed. So again, you need to wait until that's completely sealed before you start massaging around over the actual scar itself. You can, before that, massage the abdominal muscles, so just around your belly button, sort of doing circles. You can do small circles up and around your abdominal because that helps with trapped wind, which we massively suffer from. That's another acute tip, sorry, that we should talk about, is trapped wind post abdominal birth. But the more we can touch it, the more we can feel it, look at it, we're going to help improve circulation and healing. We're going to allow reconnection, which also helps with healing trauma. And it can desensitize or resensitize skin. A lot of people find their scars are numb in places, or a lot of people feel oversensitive and they can't bear to touch it. So we need to do a graded program about reintroducing it to stimuli to help just settle it down or wake it up if it's numb. So a lot of people don't know that, but scar tissue management is super important to help you heal post-abdominal birth. And then I think I've just mentioned that, but reduce your numbness or hypersensitive changes. That's so common, but it's not normal. So please, I know there's a lot of ladies out there with numb abdominal birth scars, and it shouldn't be. There are things we can do to try and help it come back to life. So I think that was a whistle-stop tour. Gosh,